As the city wakes up every morning, one set of doctors, nurses and support staff goes off duty and a new set takes over and prepare for yet another new day. Meanwhile, over 6,000 of the ill and the infirm take trains, buses or their own 2 feet to this, the smallest but most accessible major hospital in the city of Mumbai. 19 lakh patients visited our OPDs last year, far more than any other municipal hospital. While we take pulses, auscultate chests, interpret X-rays and review temperatures, the queue extends far out the door.
The amount of patients that we see in the OPD and as well as in the emergencies is phenomenal, which is the highest amongst all the 3 medical colleges in Bombay Municipal Corporation.
So every child counts and every child's life is important is the basic slogan in our mind, and we work on that. The type of cases we see here, the type of work we do here is phenomenal. We have a diverse variety of cases, and I think what you read in the books you see it here. And the type of practical work that our resident doctors get to do and we as faculty get to see is amazing.
We offer a good training program to residents because we have all the departments combined into one large department, and that is medicine. But we look into hemat, rheumat, endocrine, diabetes, neurology, everything under one roof, so the patient is seen as a whole sum.
And our OPD attendance is recently, over the last 6 months, is almost doubled. So with the same number of faculty and the residents, and there is some problem of space restriction is there. The problem is of privacy of these patients, so which is because of shortage of space in the hospital. So if we can provide that, then I'm sure our hospital can do much more wonders.
Our laboratories accept hundreds of samples every day and conduct a diverse panel of biochemical and pathological investigations. Tube after tube comes in, but Sion beats the clock every day.
Our radiology department has been, especially the CT and MR sections, have been feted throughout the country. Actually, that was the first step that Sion took to showing that we can be better than anyone else. And we have an international level team here. One of the best neuroradiologists in the country, Dr. Atul, is there. We have probably one of the few cardiac MRIs done on 3 Tesla worldwide. Our residents have done paintings on glass. My photographs are there. We have lots of miles to go, but we're really achieving that step by step.
Our ward building houses 1,462 beds. We admitted almost 83,000 patients last year.
We drain patients from far and wide, like from places around Mumbai, the periphery or the metropolitan region, as well as beyond. If a patient comes from Nanded, he comes to Sion Hospital. He stops here and then he is with us. And children have to be cared for most, I feel, in any country if you really are sensitive to your population. And that sensitivity has to be depicted in the Department of Pediatrics. Every child who comes to this hospital should have a pleasant memory of his experience here. Now obviously if you prick a child, he is going to get pain. But if you prick him and allow him to play in a play area, you can imagine that he would forget that prick pain within moments.
Hundreds of intravenous lines, tubes and catheters are inserted and countless doses of medicine administered twice, thrice and more times a day. During rounds, senior faculty employ their experience and expertise to assess and plan treatment for every patient under their care. On an average, 67 major and 76 minor surgeries are performed here every day.
We feel that since the last 2005 deluge, major departments like medicines have taken up a lot of workload, but that is the necessity of the hour. And we have got experienced in this over the years, but every year seems to be a newer challenge. You need to prepare for it each year. Most important issue is the lack of support staff from the nursing and the class 4 employees, which I hope will improve as the years come along. Over the years, the quantity has actually played a role in decreasing the quality of patient care. Yes, but still we work to the maximum. We cannot refuse patients, and whether they are requiring intensive care or not, we have been accepting them.
Now we are trying to improve the maternal mortality rate as well as the morbidity rate. So what we are doing, so last year 2014 we had 13,000 plus. 2013 we had 14,175 deliveries here. So this is a huge big figure. Even though there was a strike, we had 30 confinements, while our capacity infrastructure is for only 20. Even if I diagnose that she required the operation, I don't have another decal to access, and the fetal distress diagnosis is probably going deteriorated in front of her eyes. That's very painful. Whenever I diagnose anything and decide, I should be able to perform that one. That will improve definitely maternal morbidity as well as mortality.
Now, every year we deliver around 12,000 live-born babies. More than 50% of these babies are at high risk because their mothers are transferred in labor for various problems. And therefore, many of these babies would land up requiring admission in the NICU. So the tiny babies may sometimes have a stay as much as 2 to 3 months. The unit is always full of babies. In fact, we are overcrowded with babies. And there will be a lot of activity in terms of managing these babies aggressively, in terms of non-invasive ventilation, invasive ventilation, babies with jaundice requiring phototherapy, and all kinds of issues going on.
The only time our casualty area has been empty is probably when it was constructed. Anxious relatives wait outside, staring through the glass doors, hoping for a miracle.
The unique thing about ours is the trauma center, since our hospital is situated on the highway and close to the two railways and a very volatile society around us. We do get a lot of accident and trauma patients. We do see a lot of railway accidents, road traffic accidents. We do tackle a lot of mass casualties, disasters and mass casualty. Any time of mass casualty, just on one phone call there are 20 residents in the casualty, which is not seen in any other hospital or any other private centers.
We've also developed into a good emergency medical services because we feel that now our numbers have grown wide and large, and it's becoming difficult to organize and manage that many patients. But yet we're doing a good job with the number of residents who are quite dedicated, so that the patients then are given good care. A patient that walked in a very bad state to a state that they can really walk home on their own.
With patients overwhelmingly outnumbering doctors, even seriously ill patients sometimes have to await their turn. A lapse of a few minutes here is the gap between life and death. Breathless, unconscious, and with failing hearts, lives sometimes teeter on the edge. Our intensive care units are ever alert and always full, where we continue to breathe life into every patient, in every minute of every hour. Despite our constant struggle to balance quantity and quality, we still find the time to push the boundaries of medical science.
Ours is the only department which started this cancer chemotherapy center. There are a lot of patients getting benefited, so that we don't have to send our patients outside to Tata or other places. We see about 600 to 700 burns patients in our burns ICU. The unique thing about our burns management is we have the first and the only medical college with a skin bank, which was started in the year 2000.
One of the specialities of the Department of Neonatology is that we have the first human milk bank that was established not only in India but in Asia. The milk bank ensures that at least 3,000 to 5,000 babies who do not have immediate access to their own mother's milk actually benefit from milk from the milk bank. And because they're getting pasteurized donor human milk, it actually reduces the rates of infection, reduces the rates of intestinal problems. Similarly, for thalassemia, we have a comprehensive thalassemia daycare center, wherein not only they receive transfusions in a very comfortable environment with television. The latest addition in our department has been the Pediatric Heymann ward, with a bone marrow transplant unit established in that ward. Our children who are less privileged economically are not being deprived of the care just because they cannot afford it.
Future looks pretty bright if all that is happening on paper is translated into reality. One which you've seen, landscaping, is going to happen this year itself, or maybe by next March. That's going to change the face of Sion Hospital. It used to be a green place. As a student, I remember we used to come from KM thinking this is Lonavala, believe it or not. We're going to get it back into a green area. That's one. And the second is obviously this huge workload here, 19 lakh patients, 83,500 admissions, which is even more than KM, which is supposed to be the biggest hospital so far. Our casualty is mind-boggling. KM has 38,000, we've got 1,88,000. So if we get the requisite manpower, we're going to really blow the city away. In fact, as far as improvement in healthcare goes, we're increasing the UG seats, we're going to double the PG seats. Security will be major change now. Unfortunate incident, but fortunately our additional commissioner, director and commissioner are very helpful, and we can look forward to major changes initiated by us and supported by them. This is what Sion Hospital is going to look like in about 10-15 years time. A 3,200 bedded hospital with a dedicated multi-speciality wing, accommodation for residents, nurses in the quarters, and the barracks is going to be developed into a beautiful area with a recreation ground. So you guys owe a lot to the additional commissioner who has personally supervised all of this and will be sanctioning this very soon. So a great future if all this happens, and I'm sure it will happen. Managing this phenomenal workload with half the faculty of KM is absolutely amazing. It's like a miracle happening every day. You take any of the faculty, junior faculty, senior faculty, take the residents, take the interns, and take the medical students. We're all one big team. And I think this is what Sion is about. It's not about one individual here or one individual there. Hats off to Sion and hats off to the Sion spirit.
Diligent, positive, committed, flexible, innovative, inclusive, and inspired. For Sion, this is all in a day's work.